Good morning, everyone. See, today we'll be going to discuss about two important topics that are hamstring muscles followed by the sciatic nerve. Okay. Now, before going to the sciatic nerve, as I said earlier, you have to understand the formation of which plexus? Sacral plexus. Okay. Last time, if you remember, we have discussed about the lumbar plexus, branches of lumbar plexus. In the similar way, today we will be discussing about the sacral plexus, where it is formed, how it is formed, what are the branches, followed by the sciatic nerve. Okay. And I will be completing some important applied aspects also of the sciatic nerve. Next, before going to that, let's quickly discuss about the hamstring muscles. Now, during the dissection, I hope you have seen the hamstring muscles. All the muscles you have seen. Okay. Then you know the origin, you know the insertion of the hamstring muscles, you know the actions also. Another important point, have you studied the hip bone, everyone? Hip bone. In the beginning, you have studied about the hip bone in osteology. Now, while studying the hip bone, if you remember the ischial tuberosity, why it is important ischial tuberosity? Because the hamstring muscles which we are going to discuss, the origin are taking place from this ischial tuberosity. In hip bone, you have studied ischial tuberosity. Without studying ischial tuberosity, how come you have completed the hip bone? Okay, and that part is important because there are some muscles from which questions asked directly in the theory exam. Okay, that's why you have to, at that time you have to know the origin, insertion, nerve supply, action. Okay, these 4 points must be there. So that's why you must know from where the hamstring muscles are arising. Okay, so today we'll discuss all those things, don't worry. Now, the posterior compartment of the thigh is also called as flexor compartment. I hope you know that. Now, it is incompletely separated from the medial compartment by posterior intermuscular septum. Okay, so in this diagram you can see the posterior compartment of the thigh. Okay. Now, the posterior compartment of the thigh is also called as flexor compartment. In case of lower limb, it is opposite to the upper limb. अपर लिम्ब में फ्लेक्सर कंपार्टमेंट कौन सा है? सामने वाला, द एंटीरियर, दिस इज द फ्लेक्सर कंपार्टमेंट. व्हाट अबाउट द लोअर लिम्ब? ऑपोजिट. ठीक है, दैट मींस द पोस्टीरियर कंपार्टमेंट इज द फ्लेक्सर वन and anterior one is the extensor. Next, so we know that the compartments, how they are divided. The compartments are divided by intermuscular septa. In the first lecture of the lower limb, I have given you the brief introduction about those parts. Now, if you see, both these compartments are incompletely divided. Why? Because of this posterior intermuscular septum. Okay. Now, in that, one muscle is responsible. And which muscle is that? That is the adductor magnus muscle. Why? Because adductor magnus muscle is having two components. Adductor component and hamstring component. Okay. So, because of this muscle, the septa is not complete, it is incomplete in nature. Okay. Next, if you see the extent of the posterior compartment, it is extending from the back of the thigh to the lower limit of the gluteal region to the back of the knee. Okay, lower region of the or lower part of the gluteal region to the back of the knee, that is the extent of the posterior compartment of the thigh. Okay. Now, there also some boundaries are there. For example, floor is there, which is formed by the magnus and the vastus lateralis, and roof is there, which is formed by the fascia lata. Okay, and the magnus muscle, which is there, because of the two components, the intermuscular septa is incomplete. That means these two compartments are incompletely divided. Okay. This posterior intermuscular septum. So, which two compartment? Medial compartment and the posterior compartment. They are incompletely divided. Because of which muscle? Adductor magnus muscle. Because magnus का दो component रहता है. Adductor component and one hamstring component. Now, if anyone asks you what are the contents of this compartment, contents of the posterior compartment. Now, for that, what you have to do, the best way to take a TS at the mid thigh. Why it's best to take TS? Because the structures which are placed in the posterior compartment of the thigh, okay, they are, all the structures are not placed in same plane. Some structures are superficial, some structures are deep. Okay, so how you will see in one particular diagram? Just take a TS. सब कुछ आएगा एक साथ. Okay, so here you can see one TS is taken at the mid thigh. So this is the posterior compartment. Okay. This particular part is the posterior compartment. Okay, this is the medial compartment. This adductor muscles which are there is the medial compartment. This is the anterior compartment. So the main muscles or the main group of muscles which are present, okay, at the posterior compartment of the thigh, those are the hamstring muscles. So here you can see the hamstring muscles. Then one important nerve. Which nerve is that? Sciatic nerve is present. And blood vessels are present. Now in blood vessels, can anyone tell me which blood vessels will be present? For example, if you take the anterior compartment of the thigh, इसमें कौन सा blood vessel रहता है? Mainly femoral artery. Okay, and its branches. So what about the posterior compartment of the thigh? इसमें कौन सा muscle रहेगा? कौन सा blood vessels रहेगा? Which blood vessel will be present? What? Profunda femoris. Posterior compartment. Guess or think which blood vessels will be there. So see, direct blood vessel, you will be not getting direct blood vessel. For that, what you have to know, you have to see the anastomotic channels. Okay, so 3 anastomotic channels are present in that particular region. From above, below, these are the longitudinal anastomosis, trochanteric anastomosis, cruciate. First will be the trochanteric anastomosis, cruciate anastomosis, and then the longitudinal anastomosis. Okay. Now let me show you the diagram. So here you can see the blood vessels which are present at the posterior compartment of the thigh. So first see the trochanteric anastomosis, then cruciate anastomosis, and after that this is the longitudinal anastomosis. Okay. And from those anastomotic channels only the blood vessels will arise and it will supply the various structures in the posterior compartment of the thigh. Okay. So as you can see, this arterial anastomosis provides uninterrupted blood supply to the hip joint, muscles of the gluteal region and the posterior compartment of the thigh. Okay. So among them, these 2 anastomotic channels already we have discussed. Only this we have not discussed. Nothing is there to discuss. All the perforating branch and superior muscular branch of the popliteal artery is forming the anastomotic channel. Okay. So these are the blood vessels which are present in the posterior compartment of the thigh. So whenever you are studying any compartment, only you have to study the muscle, that is not the way. Along with the muscles, what are the other structures present? That also you have to study, you have to know. Okay. They are having clinical significance. Okay. Next we'll go to the hamstring muscles. Today's topic was related to hamstring muscle. Now by definition, what are these hamstring muscles? So there are 4 points. Okay. And if that particular muscle is fulfilling these 4 points, then only it is called as hamstring muscle. Now do you know one thing? In case of hamstring also, true hamstrings and false hamstring muscles are there. Do you know that? Okay, so we'll discuss. Now see, these 4 points are there which will define or which criteria will be fulfilled to become a hamstring muscle. So first of all, they have to take origin from ischial tuberosity. That's why today in the beginning I have asked you, have you studied about the hip bone or not? Okay. Because in the hip bone only you will be getting the ischial tuberosity, and from that ischial tuberosity only the origin is taking place. Next, insertion beyond the knee joint in the tibia, fibula or both the bones. Okay. So what is the condition for insertion? It has to cross the knee joint. Okay. Once it is crossing the knee joint, at that time it will go and it will insert into the tibia or into the fibula or in both the bones. Next, it is supplied by tibial division of the sciatic nerve. It must be supplied by the tibial division of the sciatic nerve. and it should act as a flexor in the knee joint and extensor of the hip joint. So these are 4 conditions which must be fulfilled in order to become hamstring muscle. Is it clear? So if anyone asks you by definition what are these hamstring muscle, then this should be your answer. तो जो भी hamstring muscles है, it should fulfill these 4 criteria. Then only it will become hamstring muscle. Now, among them, so we know that 4 hamstring muscles are there. Among them, semimembranosus and semitendinosus are 2 hamstring muscle because they satisfy all the above criteria. ठीक है, तो hamstring muscle में भी 2 टाइप है, true hamstring muscle and false hamstring muscle. So true hamstring muscles are those muscles which fulfill all the criteria, above criteria which I have mentioned. Now in case of false hamstring muscle, some criteria are not fulfilled. Okay, that we have to see. Now, if you see the long head of the biceps femoris and adductor magnus muscle, the hamstring part of the adductor magnus muscle, these are called modified hamstring. ठीक है, तो in hamstring 4 muscles are there, semimembranosus, semitendinosus, these are true hamstring muscles. But other 2 muscles, that is the long head of the bicep and adductor magnus, hamstring part of the adductor magnus, these are modified hamstrings. Why these are modified hamstrings? And this answer lies on the origin and insertion of these particular muscles. ठीक है, तो if you see the long head of the biceps, the origin, primitive origin is from ilium and sacrum, and subsequently this is shifted to the ischial tuberosity. Okay, the primitive origin was on the ilium and sacrum, but gradually as the evolution or as the human being evolved, at that time the origin shifted and it is now the ischial tuberosity, leaving behind the sacrotuberous as its morphological remnant. So that's why the long head of the bicep is not true hamstring. Next, if you see the ischial part of the adductor magnus is primitively inserted to medial condyle of the tibia. Okay, but after that it is shifted. Now, where it is shifted? It is shifted to the adductor tubercle of the femur. Okay, so that's why what will happen? So that the tibial collateral ligament is representing the primitive insertion. So these are some reason why these 2 particular muscles, these are modified hamstring. Is it clear what are these modified hamstring? True hamstring होने के लिए ये जो 4 points मैंने बोला था, those 4 points must be fulfilled. If the muscles are not fulfilling those criteria, then these are called as false or modified hamstring muscles. So modified hamstring muscles, which are the modified hamstring muscles? Long head of the biceps and adductor magnus muscle. Okay, why? The reason is explained. Okay. Now, so what about the short head of the bicep? If you see the short head of the bicep, it is originating from the femur and does not constitute the hamstring group of muscle, as you know. And the adductor magnus, adductor part of the adductor magnus, only the adductor part originates from the ischial tuberosity, and that is the hamstring. So the adductor part of the adductor magnus will not be considered in the hamstring group because it does not fulfill any of that criteria. Okay? So this particular point must be there whenever you are giving the explanation of the hamstring muscles. So for hamstring muscle, first point is those 4 points of the criteria, okay, for which you can call them as hamstring muscle. Okay? Next, you have to mention out of 4 which are true hamstring muscles and which are modified hamstring muscles. Next, why they are modified hamstring muscle? What is the reason or what is the justification behind that? This. Okay? After that, as usual, origin, insertion, nerve supply, action. Okay? Now, before going to the origin and insertion, do you remember this particular part? ये कौन सा part है? Which bone is this? This side, last bench. कौन सा bone है? Which bone is this? This side. This side, last bench. Stand up. You. कौन सा bone है? Hip bone. And which part is this? Wait. Which part is this? दिखाई दे रहा है? कैन यू सी? तो बोलो कौन सा पार्ट है? हाँ, विच पार्ट? यस, हाँ तुम बोलो. हाँ, ischial tuberosity. ठीक है, very good, sit down. Okay, so this part is the ischial tuberosity. Now everyone please see this particular part carefully. Why? The hamstring muscles origin is taking place from the ischial tuberosity. Now directly if you say that arising from ischial tuberosity, you are not correct. ठीक है, because that particular area is being divided. How it is divided? So ischial tuberosity, a transverse ridge is there. Now this transverse ridge is dividing it into upper quadrangular area and lower triangular area, as you can see in the diagram. Now in the upper quadrangular area, a oblique ridge is there, which is dividing into superolateral area, okay, and inferior-medial area. Okay, superolateral area and inferior-medial area. Now from the superolateral area we are getting the semimembranosus origin, and from the inferior-medial area semitendinosus and long head of the biceps. Okay, these two are arising. After that, if you go to the lower triangular area, okay, so this is the transverse ridge, this is the lower triangular area. Here one outer area is there and inner area is there. This is the inner area and this is the outer area. Now outer area we are getting the adductor magnus muscle. Okay, outer area we are getting the adductor magnus muscle, and from the inner area it is subcutaneous. Though it is subcutaneous, that's why you are getting one bursa over here. And this subcutaneous area, whenever you sit, okay, in sitting position, this subcutaneous area is supporting the weight of our body. ठीक है, whenever you are sitting, right now you are in sitting position. तो in sitting position, ये जो subcutaneous area है, this particular area, this is carrying the weight of your body. So from this part, no muscle arises, but in this particular part, one bursa is present. Okay, so this is the complete division. So here you can see this is the upper area, this is the lower area. Okay, so from this particular area we are getting the origin of the semimembranosus. Here we are getting the origin of the semitendinosus and long head of the biceps together. And if you see this lower triangular area, here from the outer part we are getting the adductor magnus, and from inner part no muscle is arising. Instead of that, one bursa is attached, because this particular part is subcutaneous. Okay, and whenever we are sitting, the body weight is transmitted by this particular area. Okay, next we'll go to the hamstring muscles. So which hamstring muscle is this? Which hamstring muscles are these two? This is the semitendinosus and this is the semimembranosus. Okay, so you can see the origin, semitendinosus plus long head of the biceps. Origin is together, that is the inferior medial impression. Okay, and where is the insertion taking place? In the upper part of the medial surface of tibia, along with the sartorius, gracilis and semitendinosus. Now here one bursa is present. Can you name the bursa? यहाँ पे ये जो तीन मसल्स एक साथ अटैच होता है on the upper part of the medial surface of the tibia, one bursa is present, and that is called as Anserinus bursa. Okay, that is called as Anserinus bursa or Pes Anserinus. Foot of bird, it resembles as foot of bird. Okay, next here you can see the semimembranosus. This is semitendinosus, this is semimembranosus. Now here you can see the superolateral impression in the upper quadrangular area of the ischial tuberosity. Okay, this is semimembranosus, and insertion groove at the posterior surface of medial condyle of the tibia. Okay, that is for semimembranosus. Next, long head of the bicep, and here you can see the short head of the bicep. The long head of the bicep same as the semitendinosus, just now we have seen, and short head from the lateral lip of the linea aspera, and after that you can see they are inserted into the head of the fibula. Okay, and in this case, till now whatever we have studied, you have seen they are mainly arising from the ischial tuberosity, and somehow they are crossing the knee joint from the posterior aspect. ये देखो, this is the knee joint, right? So it is crossing the knee joint. In previous case also you can see this is the knee joint, it is crossing the knee joint. Here also you can see it is crossing the knee joint. So the criteria which I have mentioned, at least they are fulfilling some of the criteria. ठीक है? Next, This is the adductor magnus muscle. How many parts are there? Two parts. Okay, this is the adductor part and this is the hamstring part. Okay, so can anyone tell me which opening is this? यहाँ पे एक opening है. Adductor hiatus. Very good. So the adductor magnus which is there, so this is the adductor part, okay, so it is taking origin from the ischial tuberosity, okay, the outer area, and along with that the conjoint ramus, ischiopubic ramus, okay, and if you see the insertion, it is taking place in the linea aspera adductor tubercle and it is extending up to the medial supracondylar ridge. These are the areas, okay. Now here one criteria is not fulfilled. Can you tell me which criteria? For the adductor magnus muscle, here it is not crossing the knee joint. Can you see ये knee joint है? Here it is not crossing the knee joint. That's why in the beginning I have told you there are some muscles, modified muscles, which are not fulfilling the criteria. That's why they are called as modified hamstring. ठीक है? So here you can see this is not crossing the knee joint. But if you see this particular diagram, you can see the tendon is crossing the knee joint. Now, what is the significance behind this? अगर मान लो knee joint को cross करता है, नहीं करता, what will be the significance? If it is not crossing the joint, it will not be able to produce any kind of movement in that particular joint. If it is crossing the joint either from the anterior side or the posterior aspect, then only it will be able to produce some movement in the joint. ठीक है? If a muscle, I will give one example. जो coracobrachialis है, in case of upper limb, जो coracobrachialis है, it is not crossing the elbow joint. That's why coracobrachialis, okay, coracobrachialis will not be able to produce flexion of the elbow joint. Brachialis can. ठीक है? Why? Because it is not crossing the joint. The same thing is over here. Though it is not able to cross the joint, so directly it cannot cause any movement of that particular joint. In accessory movement it can, but the prime movement जो होता है or the chief movement जो होता है, in that it cannot contribute. Okay, next you can see the hamstring muscles, how they are oriented, the origin, insertion, all those things are shown over here. Next, so we have seen the origin, we have seen the insertion. Next, which part is left? कोई भी skeletal muscle का origin होता है, insertion होता है. What are the other two parts? Nerve supply and action. Okay. So here you can see the nerve supply and action. Now, if you see the membranosus and semitendinosus innervation is the tibial part of the sciatic nerve, which is one criteria. ठीक है? So I am explaining which muscles are being fulfilling the criteria, which are not. So here you can see both the muscles are supplied by the tibial part of the sciatic nerve. So it is fulfilling that criteria also. Next criteria क्या था in case of hamstring muscle? Now the criteria is extension of the hip and flexion of the knee joint. Okay, that is also a criteria of hamstring muscle. Now here both the muscles you can see they are fulfilling this criteria. Okay, for example extension of the hip joint, and here also you can see extension of the hip, flexion of the knee joint, flexion of the knee joint. Along with that other movements are also done, that is a medial rotation. But these movements are also done by these two muscles, that's why they are true hamstring muscles. Okay. Now, if you come to this particular part, that is the biceps femoris and the adductor magnus. Now, in the biceps femoris, we know that two heads are there, long head and short head. The long head is okay, which is supplied by the tibial part, but the short head is supplied by the common peroneal part of the sciatic nerve. Okay, so that is not fulfilling the criteria. One point. Next, if you see the action, flexion of the knee joint, lateral rotation, and very weak extensor of the hip. Why very weak extensor? Already I have shown you in the diagram, previous diagram. Okay. Next, you can see the adductor magnus muscle. In the adductor magnus muscle, the adductor part is supplied by the posterior division, and the hamstring part is supplied by the tibial part of the sciatic nerve. So this part is fulfilling the criteria. So one part is not fulfilling, another part is fulfilling the criteria, and lastly action, you can see adduction of the thigh and extension of the thigh. Okay, so here you can see it is not causing any direct movement at the knee joint, okay, because it is not crossing the knee joint. Okay, so these are some basic points which you must know, that which one is fulfilling the criteria, which is not fulfilling. Based on that only true and modified hamstrings are defined. Now here, so this is the chart where you can see the hamstring muscles, the origin, insertion, nerve supply, okay, the root value, and along with that the actions. So such kinds of charts are there in your book also, you can refer to that. Okay, now while doing the dissection, have you seen the direction of the fibers in case of this hamstring muscles? When we have done the dissection of the lower limb, especially the posterior compartment of the thigh, okay, you have seen the hamstring muscles, you have done the identification of the hamstring muscles also. So at that time, while doing the identification, I hope you have noticed the fibers. Okay, if not, then you can see the fibers, how it arises. For example, in case of semitendinosus, it is having flat aponeurotic or whitish origin. जो semitendinosus होता है, if you see the origin, वो कैसे होता है? It is aponeurotic, whitish in origin, and then fibers run downwards from the tendon, rope-like whitish in the lower part of the thigh. Okay, so upper part it is flat aponeurotic. Fibers are extending downwards. When you will go to the lower part of the muscle, at that time it is rope-like whitish. Okay, so this is the way you can identify the semitendinosus. Next, if you see the direction of the semimembranosus muscle, it is membranous in the upper part and fleshy brownish in the lower part. Okay, so this is the way of doing the identification of this particular group of muscles. Next, in case of biceps femoris, so biceps femoris mein, as you know, two heads are there, long head and short head. So what will happen? The lower third of the thigh at an acute angle, both the heads join together. Once they join together, they will form a fleshy mass of muscle. Okay, and then the fiber run downwards and laterally towards the head of the fibula. So these are some important features. Next, in case of adductor magnus also, if you see the adductor part and the hamstring part, adductor part का जो muscle fiber से वो horizontal रहता है, और hamstring part का जो रहता है muscle fiber vertical रहता है. ठीक है, so these are some important features by which the identification of the muscles become easy. ठीक है, तो for the hamstring muscle I have mentioned the action. Now here you can see these are the actions of the hamstring muscle. Okay, extension of the hip joint and flexion of the knee joint. This is one of the criteria for becoming hamstring muscle. Okay, so that is all about the hamstring muscles. Applied part is left, that we'll discuss later. Now let's start with the sciatic nerve. Now before going to the sciatic nerve, why we have to study the sciatic nerve? Because here you have seen that all the hamstring muscle must be supplied by the tibial part of sciatic nerve. Okay, or tibial division of the sciatic nerve. Now what is the tibial division of the sciatic nerve? That you will understand only after you know about the sciatic nerve. Okay. Now before going to the sciatic nerve directly, we can't go. Why? We have to study the which plexus? Sacral plexus. Okay. So you have to understand the formation of the sacral plexus. Now here you can see the lumbosacral trunk. Okay, here you can see the lumbosacral trunk. Now this lumbosacral trunk I have mentioned while explaining about the lumbar plexus. Okay, it is a cord-like nerve formed by the ventral rami of L4 and the entire ventral rami of L5. Okay, some part of the L4 ventral rami and entire L5, they join together to form a cord-like structure, that is the lumbosacral trunk, as you can see in this diagram. Now after formation it descends down. Have you studied the sacrum? Till now have you studied the sacrum bone? No. Okay, then you will not know. Now when it is descending, at that time it is situated in front of the ala of the sacrum. जो sacrum होता है उसका एक part होता है, that is called as ala of the sacrum. This part, ये sacrum bone है, ठीक है? This is the sacrum bone. This particular part is called as ala of the sacrum. ठीक है? As you can see, it is extending downwards in front of the ala of the sacrum. Now, after that, it crosses the pelvic rim in front of the sacroiliac joint, and then it will join the first sacral nerve. Okay. Now, once it is joining the first sacral nerve, then it will help or it will contribute in the formation of the sacral plexus. Okay. So that is the fate of the lumbosacral trunk. Now, sacral plexus. So, what is this sacral plexus? It is a plexus of nerves that lies in front of the piriformis muscle, very important, okay, on the posterior wall of the pelvis. Though you have not studied the pelvic cavity, so there will be some difficulties, okay, as you will start the abdomen, and in the abdomen when pelvic cavity will be taken, at that time things will get clear. Now please remember that ये जो sacral plexus है, it is a plexus of nerve, and where it is situated, in front of which muscle? Piriformis muscle, okay, that also on the posterior wall of the pelvic cavity. Now, if you see the root value, okay, that is L4, L5, S1, S2, 3, 4. Okay, that is the root value for sacral plexus. Now, how the sacral plexus is formed, that you have to know, means what are the contribution from these various segments of the spinal cord. First of all, lumbosacral trunk, entire lumbosacral trunk, as we have seen, it is extending downwards. Then part of the primary rami of L4, then entire ventral rami of L5, entire ventral rami of S1 to S3, and part of ventral rami of S4 spinal nerve. Okay, these are the contribution from the various segments of the spinal cord to form the sacral plexus. Okay, now sacral plexus, it is formed, as I said, in front of the piriformis, deep to the pelvic fascia on the posterior pelvic wall. Now there are some important relations of this particular sacral plexus. Now what are those? These are the internal iliac vessels, ureter and sigmoid column. These are some important relation or important structures which are related to the sacral plexus. Now इसका भी एक clinical applications है. Now this I am not going to discuss right now. That will be discussed in the pelvic cavity chapter. Not now. Okay, because things will get mixed. Now here is the diagram. Now in this diagram you can see the sacral plexus. Okay, so how it is formed? You can see part of L4, then entire L5, S1, S2, S3, and part of S4 together. It is forming the sacral plexus. Okay, and along with that, here you can see the branches of the sacral plexus also. Okay, now what are the branches of the sacral plexus? Now the branches are divided. Okay, now how it is divided? First of all, we are having muscular branches, then terminal branches are there, and then the way it is arising branches, okay, on the anterior aspect and on the posterior aspect, it is called as branches on the pelvic surface and branches on the dorsal surface. Okay, so like this the classifications are done. So first you can see the branches of the sacral plexus, from the branches arising from the roots. Muscular branches are there which supplies the piriformis, levator ani and coccygeus. These are the muscles of the pelvic wall. Okay, and then a pelvic splanchnic nerve are also called as nervi erigentis. Anyone have you heard about this one? Pelvic splanchnic nerve. This is a parasympathetic division of the sacral plexus. Okay. Now, what is the speciality of this nerve? Actually, these nerves will go and supply the organs which are present in the pelvic cavity. Okay, pelvic cavity में जो organs रहता है, for example, urinary bladder is there. In case of female, uterus is there, ovaries are there. ठीक है? So ये जो organs है, parasympathetic division of those organs are done by this pelvic splanchnic nerve. ठीक है? Next, terminal branches are there. So what are those two terminal branches? Sciatic nerve and the pudendal nerve. And here you can see the branches from the pelvic surface, that means from the anterior surface, and branches from the dorsal surface of the plexus, that means the posterior aspect of the plexus. Okay. Now here from the pelvic surface only two nerves are arising, that is the nerve quadratus femoris and obturator internus. You can see the ventral division, and see from the dorsal surface superior gluteal nerve, that means all the nerves which you have studied in case of gluteal region, okay, they are arising from this dorsal surface of the plexus. For example, you can see superior gluteal nerve, inferior gluteal nerve, posterior cutaneous nerve of thigh, perforating cutaneous nerve, perineal branch. Okay, so these are arising from the posterior aspect of the plexus. Now there are some nerves which are arising from the ventral division and some nerves arising from the dorsal division. ठीक है, तो जो root होता है, root से the nerves which are coming out उसका further ventral division and dorsal division होता है, and from there only we are getting the branches. ठीक है, now which particular branch is from ventral division, which branch is from dorsal division, for that one chart is there. Why it is important? Because see here nerve to quadratus femoris see from ventral division, and if you see over here superior inferior gluteal nerve, you can see dorsal division, right? So some nerves are from arising from dorsal and some nerve arising from the ventral division. That's why what I have done, I have collected them together and one chart is there. You can see this chart. So these are the nerves which arises from the dorsal division, and you can see these are the nerves which arises from the ventral division. Okay, so this particular chart will help you to understand about the origin of the various branches of sacral plexus. Next, in the sacral plexus, it's not possible to explain all the branches. Okay, you have seen number of branches are there. So directly we'll go to the sciatic nerve. But before going to that, here is the highlight of all the important nerves which are the branches of the sacral plexus, and along with that the divisions also. Okay, so here mostly we'll be discussing about the sciatic nerve and the divisions of the sciatic nerve. This is the tibial portion and the common perineal portion of the sciatic nerve. This will be discussed. Because देखो so many nerves are there, it's not possible to complete in one or two classes. ठीक है, और इसमें कुछ है भी नहीं. If you read from your own, you can understand. Nothing is there to explain. So this is the overview of the sacral plexus. Here you can see the formation, how it is forming. Okay. Then in the contents from the roots, what the branches, terminal branches from the pelvic surface and from the dorsal surface. Okay. This is the thing what you have to know from the sacral plexus. ठीक है, and why I am showing you this, because I have seen you can check your book whatever you are following. ठीक है, उसमें directly sacral plexus के बारे में नहीं दिया है. Directly they have started from the sciatic nerve. ठीक है, but I felt that sacral plexus must be explained in order to make you understand about the sciatic nerve. Now though sacral plexus is done, now it will be easier for you to understand the sciatic nerve. Okay. Now before starting with the sciatic nerve, can anyone tell me what are the peculiarities of the sciatic nerve? If you have studied somewhere. First of all, it is the thickest nerve of our body. Okay? It is the thickest nerve of our body. If you see the thickness approximately 2 cm. Have you seen the sciatic nerve in the dissection class? सबने देखा है sciatic nerve? हाँ. Next, I don't know whether you have studied this or not. Sciatic nerve is the only peripheral nerve in our body which is directly accompanied by one blood vessel. जो sciatic nerve है, okay, thickness इतना ज़्यादा है, तो one blood vessel is there which is directly accompanying this particular nerve. Okay, and that is a branch of inferior gluteal artery. Okay, because it needs blood supply. So many nerve fibers are present. So these are some peculiarities. So in your book, such kind of peculiarities are given. Okay. So I will request everyone to study this particular part from your own. The peculiarities of the sciatic nerve. Now, any nerve, if you remember the femoral nerve, obturator nerve, okay, in the lumbar plexus. So what is the beginning or what are the points must be there in order to explain any of the nerves? First, what you have to mention? Origin. These are the tubular structure. तो tubular structure का कोई भी part आया तो you have to mention first the origin. ठीक है? तो what is the origin of that particular nerve? After that, course of that nerve. That means after origin, in which direction it is going. Either it is ascending upward or downwards. Okay? That is the course. After that, Yes, very good. Course के बाद termination कहाँ पे जाके terminate होता है? Okay. After that, from nerve, what you have to mention? Branches. What are the branches coming out from that nerve? Okay. Now, please note that in case of branches, you have to be very specific. For example, from sciatic nerve, we will see that some muscular branches are there. Okay. Then some articular branches are there, which will supply the joint. Then cutaneous branches are there. So like this, you have to categorize them. You have to write them separately. Which are the different types of branches arising from that particular nerve. Okay. Next, relations, though it is a important nerve, okay, and it is passing through different regions of the lower limb. Can anyone tell me what are the different regions in which the sciatic nerve is present? Lower limb का तो dissection हो गया है, तो you have seen the sciatic nerve. So can anyone tell me what are the areas or what are the regions of the lower limb where sciatic nerve is present? See why I am asking? Because when you will write the codes of the sciatic nerve, okay, at that time you have to mention that what are the areas where sciatic nerve is present. For example, it is present in the gluteal region. Okay, it is present in the posterior compartment of the thigh, and then it is extending up to the popliteal fossa, superior angle of the popliteal fossa. वहाँ पे जाके terminate होता है. ठीक है? So these are the areas where this sciatic nerve is present. So first you have to mention about that. Next, whenever you are writing about the relation, तो जो gluteal region है वहाँ का relation अलग होगा. Then at the posterior compartment of thigh, relations are different, and when it is reaching the popliteal fossa, it is different. Okay, so these points must be there whenever you are writing about the sciatic nerve. Okay, so the way we have I have mentioned, all those things will be discussed. So first of all, it is the branch of the sacral plexus, largest branch, and if you see the width, it is approximately 2 centimeter. Now how it is formed? Now it is having two components, that is the tibial component and the common peroneal component. Okay, so tibial part, it is formed by the anterior division of the ventral primary rami L4, L5, S1, S2 and S3. Okay, and in case of common peroneal, it is formed by the posterior division of the ventral primary rami. So tibial division or tibial component, how it is formed? From the anterior division of the ventral primary rami, and from the common peroneal part, posterior division of the ventral primary rami. Okay, so ventral primary rami, when it is coming out from the spinal segment, uska further division hota hai, anterior division and posterior division. Okay, so anterior division of L5 to S3 will form the tibial part, and from L4 to S2, that also posterior division of the ventral primary rami, will form the common peroneal nerve. Okay, so this division part must be there. Next, if you see, so in this diagram you can see the anterior division and you can see the posterior division. So for anterior division, it is shown in green color, and for posterior division it is shown in grey color, so that you can see the divisions. Okay, तो जब sciatic nerve का formation होता है, especially from sacral plexus, it's better to use this kind of diagram. Okay, which will clearly make you understand that how it is forming, what are the two divisions. Next, as I have asked, what are the different areas? So sciatic nerve passes through different regions: pelvic region, gluteal region, and back of the thigh up to the superior angle of the popliteal fossa. Okay, so these are the different regions in which you will get the sciatic nerve. इसका मतलब क्या है? 2 points. First, whenever you are writing the codes, you have to mention that how it is passing this particular region. Okay. Next, when we will mention the relation, at that time also you have to mention that what are the structures situated around the sciatic nerve in this region, in the pelvic region, in the gluteal region, and in the back of the thigh, up to superior angle of the popliteal fossa. That will complete your answer. Okay. Now, if you see the codes of the sciatic nerve, so for your convenience, I will show how to write. So here you can see codes and termination. तो see in the pelvis, in the gluteal region and in the thigh. ऐसे लिखना है. Okay, this is the way you have to write. So first of all, in the pelvis, what happens? The nerve lies in front of the piriformis. जब formation होता है, okay, under cover of the fascia, piriformis fascia. Next, how it enters the gluteal region? It enters the gluteal region through greater sciatic foramen. Okay, as you can see, it enters the gluteal region through greater sciatic foramen below the piriformis. So we have studied the piriformis muscle, which is dividing the greater sciatic foramen into two parts. Okay, the structure passing above piriformis, below piriformis. So this is passing below piriformis. Okay, next, once it coming out through the greater sciatic foramen, at that time what will happen? You can see it is having slight lateral convexity. ऐसे convex course होगा. Greater sciatic foramen से ऐसे निकल के आता है, then ऐसे convex course होता है. ठीक है, ऐसे straight नहीं होता है. Convex है, then straight. Okay, so this convex course passing between the ischial tuberosity and greater trochanter. In between the ischial tuberosity and greater trochanter के बीच से एक curved course होता है. ठीक है. After that, it enters the thigh. So in the thigh, sciatic nerve enters the back of the thigh at the lower border of the maximus. Once it crosses the lower border of the maximus, it enters the thigh region. Okay? So that also you have to mention. Now, if you see the course in the thigh, it is vertical. Okay? And then it is extending up to the superior angle of the popliteal fossa, where at the junction of upper 2/3 and lower 1/3, it terminates into dividing in by tibial and common peroneal nerve. Okay. Now here you can see the diagram. So see, this is the area where it is present in the gluteal pelvic region. Then it comes in the gluteal region, and then here you can see it is in the posterior compartment of the thigh. Okay. So these are the areas where this particular nerve is present, and you have to mention accordingly one by one. Now, what are the relations in the pelvis? What are the relations in the gluteal region? If you see the pelvis, sciatic nerve in the pelvis lies on the anterior surface of the piriformis. Okay, as you can see, it is lying on the anterior surface of the piriformis. Here, देखो, over here, anterior surface of the piriformis, which is covered by the fascia. Next, in the gluteal region, it enters the gluteal region through greater sciatic foramen below the piriformis muscle. You can see it is coming out below the piriformis muscle. Okay. Next, superficial relation. That means what are the structures present superficial to the gluteus maximus. Now you can see long head of the biceps femoris can be seen. Okay. This long head of the biceps femoris can be seen. After that, in the deep relation, body of the ischium. Okay. Deep relation. If you see over here, here will be the body of the ischium present. Okay. Then tendon of the obturator internus with inferior gemelli, quadratus femoris, adductor magnus. These are the structures situated deep to the sciatic nerve. Okay, and in the medial relation, okay, here you will be getting the medial relation. In the medial relation, inferior gluteal blood vessels will be present. Okay, another diagram is there. So here you can see. So this is the medial aspect. So in the medial aspect, you can see inferior gluteal artery and few branches of the inferior gluteal arteries there. Okay, and in the beginning I have mentioned you that there is a artery, as you can see, sciatic nerve accompanying by the artery. So see, this is a branch of inferior gluteal artery. So one blood vessel is there which will accompany the nerve. Okay, because it is very thick, needs blood supply. That's why an artery is dedicated to this particular nerve. This is also a peculiarity, okay, of the sciatic nerve. So these are some relations. Next, if you see the relations in the thigh, as I have shown you, long head of the biceps femoris, adductor magnus, then medially semimembranosus, semitendinosus will be there. Okay, so this is the course of sciatic nerve in the thigh. Okay, now this is the lateral side, this is the medial side. So on the medially you will be getting the semimembranosus, semitendinosus, and on the lateral side you will be getting the biceps femoris. Here also you can see the diagram. So this is the way to mention about the relations at various level. Okay, so and the blood supply already I have shown you, there is a companion artery, and from where it is coming out? It is coming out from the inferior gluteal artery, which is accompanying the sciatic nerve. So we have seen the origin, we have seen the codes, that also we have divided the codes. In which regions we have divided the codes? In the pelvis, in the gluteal region, and in the posterior compartment of the thigh up to superior angle of popliteal fossa. Okay, I don't know whether you have noted these points or not. Now once it is done, and at the superior angle it is bifurcating, or it is terminating into two branches. What are they? Tibial and common peroneal nerve. So that is the termination of the sciatic nerve. Now here also you can see the termination. Can you see the termination? In this diagram, can you see the termination? Okay. Here also you can see, after reaching over here, it will terminate. Here also you can see it will terminate over here, and this is the popliteal fossa, right? This is the popliteal fossa. You know the shape of the popliteal fossa. What is the shape? Diamond shape है, ठीक है? तो ऐसे superior angle रहता है, inferior angle भी रहता है. ये जो superior angle है, वहाँ पे जाके terminate होता है, ठीक है? As you can see, okay, in two division. Okay, so termination also done. Now what is the next part? Branches. So how to divide the branches? How we will divide the branches? First of all, we will see the articular branches. Articular branches means it will supply which part? It will supply the joint. Okay, articular का मतलब क्या है? Joint. As simple as that. Articular branches will supply the joint, especially the hip joint. Next, the muscular branches. Now, in order to write the muscular branches, though two components are there separately, so you have to mention muscular branches arising from which components. Okay, and please note that जो gluteal region है, in gluteal region sciatic nerve is not giving any muscular branch. In gluteal region we know that so many muscles are present. Okay, maximus, medius, minimus. Okay. All those muscles are present, so not a single muscular branch is given, okay, by the sciatic nerve. In the posterior compartment of thigh, the nerves are given. So you can see in the green color it is tibial part, and in the gray color it is common peroneal part. So the muscular branches, the tibial part, you can see semimembranosus, semitendinosus, long head of the biceps, and adductor part of the hamstring part of the adductor magnus. Okay, these muscles are getting muscular branch from the tibial part of the sciatic nerve, and only one muscle, that is the short head of the biceps femoris, it is getting from the common peroneal part. Okay, or you can say common peroneal component of the sciatic nerve. That's why it is not under hamstring group. Okay, so that is all about the sciatic nerve. Now after that, can you see this particular part? So here sciatic nerve is terminating. So this is the, you can say, popliteal fossa. Okay. Now here you can see this is the tibial nerve, and this is the common peroneal nerve. Now, have you seen the course of the common this one tibial nerve and the course of the common peroneal nerve further, or have you studied? क्या होता है? From the posterior compartment of the thigh, okay, you are getting, after that anterior compartment of the leg is there, and posterior compartment of the leg is also there, and the lateral compartment is also there. Now for that, from where the nerve supply comes? कहाँ से आता है nerve supply? From here only. These two nerves only, they will further divide. For example, ये जो tibial nerve है, that is the main nerve of the posterior compartment of the leg. ठीक है, ये जो posterior compartment of the leg है, उसका main nerve है, this is the tibial nerve. Common peroneal का क्या होता है? Near the neck of the fibula. Okay, near the neck of the fibula, it again divides into superficial and deep peroneal nerve. Okay, superficial peroneal nerve कहाँ पे जाएगा? Anterior compartment में जाएगा. Deep कहाँ पे जाएगा? Lateral compartment of the leg. Okay, so these are some divisions of this particular nerve, tibial nerve and common peroneal. After that, as usual, same tibial nerve, what is the origin, what is the course, okay, then where is the termination, what are the different branches. In branches also you have to classify the branches, okay. For example, what are the articular branches, what are the muscular branches, cutaneous branches, as usual. Okay, same thing have to be repeated. Okay, just now we have discussed about the sciatic nerve. Okay, in sciatic nerve we have seen what are the relation, what are the branches, okay, course, termination. Now, in case of sciatic nerve, the two terminal branches are the tibial nerve and common peroneal nerve. Now, if you go further to trace the tibial nerve and common peroneal nerve, you have to go to the different compartments of the lower limb. Now, we'll start with the tibial nerve. As I said, only one or two will be explained. Remaining, you study from your own. Okay. So we'll see the tibial nerve. Just see how the tibial nerve is being described. Okay. So it is the major nerve that supplies the posterior compartment of the leg. It is a major nerve. Where it is present? It is present in the posterior compartment of the leg. Now, what is the root value? In root value, you have to mention the ventral rami. Okay, of L4, L5, S1, 2 and 3. Okay, that is the root value. Next, after root value, that will be the course of the particular nerve. So, this is the largest terminal branch of the sciatic nerve. Once origin, where it will go, it will descend vertically downwards in the popliteal fossa from its superior to inferior angle. In the popliteal fossa, we know superior angle and like this inferior angle is there. So it is extending downwards vertically, okay, over the popliteal fossa from its superior angle to inferior angle. Then it crosses the popliteal vessels. In the popliteal fossa, you know that popliteal vessels are present. So it is crossing the popliteal vessels. How it will cross? From lateral to medial side. Okay. So as it is descending, at that time it is crossing the vessels from medial to lateral side. Okay. Later it goes into the posterior compartment of the leg. Now once it is in the posterior compartment of the leg, if you see the diagram, here you can see it is continuing in the posterior compartment of the leg. It is the undercover of the tendinous arch of soleus muscle. Okay, so that means in the posterior compartment of the leg, this particular nerve, tibial nerve, is situated deep to the soleus muscle. Okay, and throughout its course in the leg, it is accompanied by, or it is accompanying the posterior tibial artery. Okay, or posterior tibial vessels, as you can see in the diagram. Okay, so it will follow the course of the posterior tibial artery in the leg. Now, where it will terminate? It will terminate by dividing into medial and lateral plantar nerves, as you can see in the diagram. I hope you have studied about the retinaculum of the lower limb, flexor retinaculum, extensor retinaculum. Yes. So when it is extending, okay, at that time before termination, what will happen? It terminates by dividing into medial and lateral plantar nerves, which is passing deep to the flexor retinaculum. Okay. So it will pass deep to the flexor retinaculum. At that time, it will divide into two branches, medial and lateral plantar branch. So which will go and supply the medial and lateral aspect of the plantar surface of the foot. So this is the way to explain about any of the nerves, especially in case of lower limb. Next, if you see the branches, the four branches, here you can see the diagram showing the branches of the nerve, tibial nerve. So what are the different types of branches we are getting? Cutaneous branch, that is the medial calcaneal nerve. Okay, then sural nerve. The most important cutaneous branch of the tibial nerve is the sural nerve, as you can see over here. This is the sural nerve. Okay. Now, what do you think? Which area is supplied by the sural nerve? Lower half of the back of the leg and lateral border of the foot till the little toe. Lateral border of the foot till the little toe, that particular area, and lower half of the back of the leg. These are the areas which are supplied by the cutaneous innervation by this sural nerve. Next, articular branches are also there. You can see these are the genicular branches. Okay, so these articular branches are for inferior tibiofibular joint, for ankle joint, and two terminal branches are there. What are the terminal branches? As you can see, that is the medial plantar nerve and lateral plantar nerve. So first I have told you about the cutaneous branches, then I have mentioned about the articular branches, then I have mentioned about the terminal branches. Which branch is left? Just see the diagram. This is the cutaneous branch. Okay, these are the articular branches. Okay, and these are the terminal branches. Which branches are left? Muscular branches. See, these are the muscular branches. These branches are left. Okay, so in the muscular branches arise from the distal part of the fossa. So these muscular branches arise in the distal part of the fossa. Now if you see the muscular branches, where it supplies, you can see the plantaris, medial head of the gastrocnemius, lateral head of the gastrocnemius, even popliteus also. And then if you come to the leg, all the muscles of the leg, starting from the soleus, tibius posterior, flexor digitorum longus, flexor hallucis, all these are supplied by the tibial nerve. Now, can anyone tell me what is the peculiarity for the popliteus muscle? Peculiarity to the nerve of popliteus muscle? Let me show you the diagram. So here you can see all the branches. Now this is the popliteus muscle. As you can see, this is the popliteus muscle, and this is the nerve to popliteus. So what is the peculiarity for the nerve to popliteus? Anyone? First of all, it crosses the popliteal vein, popliteal artery from medial to lateral. Popliteal vein and popliteal artery from medial to lateral. And after that, what happens? It winds around the inferior border and then goes on the anterior aspect of the popliteal muscle, or you can say deep to the popliteal muscle, and then it supplies the popliteus. Next, from this particular branch, we are getting a branch for the tibialis posterior muscle. Okay, then we are getting one branch for the superior tibiofibular joint and one branch for the medullary cavity of the tibia. Okay, so this is the peculiarity of the nerve supply of popliteus muscle. तो सीधा से मतलब क्या है? डायरेक्टली जैसे मान लो यहाँ पे इट इज कमिंग एंड सप्लाइंग द मसल डायरेक्टली, यहाँ पे देखो डायरेक्टली सप्लाई नहीं हो रहा है, ऐसे घूम के आता है एंड देन इट इज गोइंग टू द डीप और यू कैन से एंटीरियर सरफेस ऑफ द popliteus muscle, then it is supplied. After that, from this nerve to popliteus, you can see several branches are arising. Okay, that will supply the tibialis posterior muscle, superior tibiofibular joint, and for the medullary cavity of the tibia. Okay, so these are the peculiarities for the nerve supply of popliteus muscle or nerve to popliteus muscle. Okay, so this is the tibial nerve. Now after that, which one? Common peroneal nerve. Okay, now here you can see the common peroneal nerve. So it is the smallest terminal branch of the sciatic nerve. What is the root value? It is the ventral rami of L4, L5, S1 and S2. Okay, now here in the diagram you can see the codes. So it is coming on the anterior aspect of the leg. The common peroneal nerve begins at the superior angle. वहाँ पे divide होता है tibial and common peroneal. From the superior angle, the course starts. Okay, of the popliteal fossa under cover of the long head of the bicep, then run downwards laterally along the medial border of the biceps femoris towards the lateral angle of the popliteal fossa. तो in popliteal fossa like this lateral angle रहता है, ठीक है? तो from the superior angle it goes towards the lateral angle of the popliteal fossa, ठीक है? Now once it reaches the lateral angle of the popliteal fossa, after that what will happen? It will wind around the neck of the fibula. And then it will pierce the peroneus longus muscle, ठीक है? And then it divides into superficial and deep peroneal nerve, as you can see in the diagram. It is dividing into superficial and deep peroneal nerve. Okay, so once it is winding around the neck of the fibula, ठीक है? At that time, from the posterior aspect, it is coming to the lateral aspect. Neck of the fibula laterally रहता है, and in that part it is piercing the which muscle? Peroneus longus muscle, and then it divides into two, superficial and deep peroneal nerve. Okay. Now, if you see the superficial peroneal nerve, see this is the superficial peroneal nerve and this is the deep peroneal nerve. So this deep peroneal nerve, where it will go? It will go into the anterior compartment of the leg. Deep peroneal nerve. And what about the superficial peroneal nerve? Where it will go? Into the lateral compartment of the leg. Okay. And after that, same, the way we have discussed about the tibial nerve. Okay. Same thing. You have to know the codes, you have to know the termination, you have to know the different types of branches. That's it. Okay. So this part I will skip. I will request everyone to study this one. Okay. Nothing is there to explain. Okay. So here you can see the termination of the sciatic nerve. This is the tibial nerve, and here you can see the common peroneal nerve. Okay. Now this is the lateral angle. From the lateral angle, you can see it is going laterally. Okay. So it is winding around the neck of the fibula, and then see this is the neck of the fibula, and then facing the peroneus longus muscle, and after that it is dividing into two branches. Okay. That is the superficial and deep peroneal nerve. So here you can see the course of the deep peroneal nerve, and here it is the superficial peroneal nerve, जो lateral compartment पे रहेगा. Next, as usual, branches. So here also you can see the common peroneal nerve. You can see the branches. This superficial peroneal nerve and deep peroneal nerve. Okay. So in the superficial peroneal nerve, you can see the muscles which are supplied. Mainly two muscles are there on the lateral compartment. What are they? Peroneus longus and peroneus brevis. ठीक है. And जो anterior compartment है deep peroneal nerve will supply this particular muscles. Okay. Now this chart is very important because whatever I have discussed so far, okay, everything is given in this chart. You can see the sural nerve, you can see the tibial nerve, common peroneal nerve, superficial peroneal nerve, deep peroneal nerve. Okay, you can see the origin, you can see the course and distribution in the leg. Beautifully it is given point wise. Okay, so this kind of charts you must prepare from your own. Okay, so that in one chart you can revise all the nerves. That becomes easy. Okay, now let's discuss about the applied part. So in the applied part, first sciatic nerve block. So today we have seen the origin of the sciatic nerve. We have seen the codes, termination. Okay. This sciatic nerve block already we have discussed in the gluteal region. So how the sciatic nerve block is done? To block the sensation conveyed by the sciatic nerve, anesthetic agents are injected. Where it is injected? 4 to 5 centimeter below the midpoint, where line joining the posterior superior iliac spine and greater trochanter. Okay, so the line between the posterior superior iliac spine, okay, and from the greater trochanter, जहाँ पे intersect होगा, वहाँ से approximately 4 to 5 centimeter below. What you have to do? You have to inject the anesthetic agent in order to block the sensation from sciatic nerve. That is called sciatic nerve block. Okay. Next, in the knee joint, I know you have studied the applied anatomy. Now, there is an important applied aspect of the knee joint that is called Baker's cyst, as you can see in the diagram. Okay, or also called as popliteal cyst. तो इसमें क्या होता है? Fluid collection होता है behind the knee joint. As you can see, the collection of fluid will take place behind the knee joint. Okay. Now here, posterior herniation of the cyst of the synovial membrane is taking place. Posterior herniation of the synovial membrane is taking place. Okay. Now in that, what happens? Inflammation of the bursa is there, which is lying deep to the semimembranosus. In such condition, the restriction will be, movements will be restricted and pain will be there when movements are there in the knee joint. So that is the Baker's cyst. Okay, next sciatica. Anyone have you heard about this term sciatica? Let me show you the diagram. Here you can see the diagram for sciatica. तो क्या होता है? Actually, it is a clinical condition, okay, in which there is shooting pain along the distribution of the sciatic nerve and its branches. Okay, तो एक particular point पे pain नहीं होगा. There will be pain along with the distribution of the sciatic nerve and its branches. That's why, can you see this area, highlighted area? So whenever sciatica is there, at that time there will be shooting pain, numbness, tingling sensation. All those sensations will be there. Okay, throughout the distribution of the sciatic nerve and its branches. Okay, so here you can see the area which is particularly supplied by the sciatic nerve and its branches. So this particular area will be affected. Now, इसमें क्या होता है? The pain usually begins in the gluteal region and spread over the back of the thigh, lateral side of the thigh, and dorsum of the foot. These are the areas of the lower limb which are affected. Now, what is the cause? There are different causes. Among them, one important cause is the herniation of the disc. Now, you have not studied the intervertebral disc till now. Okay? So, if you see the diagram, this is the intervertebral disc. जो वर्टिब्री होता है, आई होप यू हैव सीन द वर्टिब्रल कॉलम. ठीक है, वर्टिब्रल कॉलम में इंडिविजुअल वर्टिब्री होता है. तो इन बिटवीन द टू वर्टिब्री द इंटरवर्टिब्रल डिस्क इज प्रेजेंट. ठीक है, एंड इंटरवर्टिब्रल डिस्क का दो पार्ट रहता है. द सेंट्रल पार्ट इज कॉल्ड एज न्यूक्लियस पल्पोसस एंड द पेरिफेरल पार्ट इज कॉल्ड एज एन्युलस फाइब्रोसस. नाउ व्हेनेवर द herniation is taking place, disc herniation, at that time what happens? This annulus fibrosus, okay, it herniates and then it compresses the spinal nerves which are coming out. Okay, you can see it is herniated nucleus pulposus, and then what will happen? It will compress the spinal nerve. Okay, so from here the spinal nerve is coming out, you can see on both the sides. So it is compressing the spinal nerve. So because of this compression, what will happen? Throughout the distribution of the nerve, okay, pain will be there, pain, numbness, all those problems will be there. Okay, so that is the sciatica. And the compression takes place in which region or which segment of the vertebral column? It is L4, L5 and S1 segment of the spinal cord. L4, L5 and S1 segment of the spinal cord. If in this segment the compression is taking place, nerve compression, then sciatica will be there. Now other causes are also there. Another sciatica, for example, piriformis syndrome is there. Okay? Then in case of pregnancy also sciatica occurs. Okay? So these are the conditions of the sciatica. Next, the sciatic nerve injury. Now the sciatic nerve injury may be injured in the penetrating wounds and dislocation of the hip joint. You have studied the hip joint, dislocation of the hip joint also you have studied. So during the dislocation of the hip joint also sciatic nerve may get injured. Okay, at that time what will happen? Loss of all movements below the knee and along with that foot drop will also take place. ठीक है, अगर sciatic nerve का injury होता है in the gluteal region, it may be because of the penetrating wound or because of the dislocation of hip joint. At that time, what will happen? There will be loss of movements below the knee and along with that foot drop will also be there. Next, sensory loss of the back of the thigh, whole of the leg and the foot except the area which are innervated by saphenous nerve. So these are the sensory loss taking place. Okay. So that is about the sciatic nerve injury. So you have to mention the injury of the sciatic nerve. See, first of all, in this case, I have mentioned the injury to the sciatic nerve or compression of the nerve during the origin. Next, injury can take place in the gluteal region. Okay, so these two cases are there which you have to mention or which you have to know. Next, other nerves are also there. For example, superficial peroneal nerve. Just now I have shown you the superficial peroneal nerve. Okay. Suppose the superficial peroneal nerve is injured, then what will happen? Now, if there is any trauma or nerve compression on the lateral compartment of the leg, at that time this superficial peroneal nerve is get injured. At that time, what will happen? There will be loss of eversion of foot, ankle joint, then subtalar joint. I don't think so. You have studied. Okay. Next week, those things will be taken. At that time, we will come to know what is eversion and inversion of foot. Okay. So this is the inversion of foot and this is the eversion of foot. Inversion, eversion of foot. So these are the dorsiflexion, plantar flexion. Okay. This is the inversion, this is the eversion of foot. Okay. So these are the various movements of the foot. Now these movements are not only taking place in the ankle joint. There are other joints also below the ankle, and those are called as subtalar joints. Okay, so for that I think 1 or 2 separate classes are there which you have to study. So if there is any injury to the superficial peroneal nerve, at that time what will happen? There will be loss of eversion of foot due to paralysis of the peroneus longus and peroneus brevis muscle. Okay, then sensory loss will also be there. Lower 1/3 of the leg, most of the dorsum of the foot, except the first web space which is supplied by the deep peroneal nerve. Okay. Now, if there is any injury to the tibial nerve में injury हो गया, which is situated in the posterior compartment, then what will happen? Patient is unable to plantar flex his or her ankle. Okay. Along with that, there will be fluing of the toes due to paralysis of intrinsic muscles of the sole. So these are some applied importance related to the tibial nerve. Now, before going to the next section, I hope especially girls used to like to wear high heels. Yes, whenever you are going to any party or any suppose reception and all, do you think it is good to wear? Please listen carefully. This side, last bench. So whenever you are, this is especially for the girls. Whenever you are wearing high heels, do you think it is good for your lower limb? There is a terminology called smart high heels. No discussion. There is a terminology called smart high heel. इसका मतलब क्या है? See, today you have to understand this concept. Okay. So this is called smart high heel. Now what exactly is this smart high heel? So if high heels are being used for long period of time, at that time what will happen? It will cause the change in the posture. Suppose you are wearing high heels, okay? At that time what will happen? It will cause change in your posture. Now what are the changes? First of all, knees are exclusively bent with lumbar vertebra pushed forward. Okay, knee joint is bent, that means semi-flex condition, and the lumbar vertebrae are pushed forward. That is one change in the posture. Second change, lot of stress on the muscles of the back and those of the cuff. Okay, stress will be there on the muscles of the back and on the cuff muscle. That's why, so these are the change in the posture taking place. So that's why what is this smart high heels? So what you have to do, you should wear the high heels for short time and change to flat as soon as possible. Okay. Why? So that these particular structures will not get stretched. That is called as smart high heels. Okay. Next, I hope you have heard about the foot drop. In upper limb, you have studied wrist drop. Everyone, do you remember? In upper limb, while studying about the radial nerve, okay, applied importance of radial nerve, you have studied that there is a condition called wrist drop, right? Same thing is there in case of lower limb, but it is called as foot drop. Okay. Now, what is exactly this foot drop? And why it occurs and which nerve is involved in case of foot drop. Okay? And this is very important. So exam में question कैसे आता है? Write the anatomical basis of foot drop. लिखो. Write the question. Write the anatomical basis of foot drop. 5 marks. Okay. Write the anatomical basis of foot drop. So what exactly you have to write and which diagram you have to draw? Let's see. Now if there is a paralysis of the muscles of the anterior compartment of the leg. Now can anyone name the muscles of the anterior compartment of the leg? Anterior compartment में क्या-क्या muscles रहता है? Tibialis anterior, extensor hallucis longus, extensor digitorum longus and peroneus, tertius. These are the muscles present in the anterior compartment of the leg. Now, if these muscles get paralyzed, okay, at that time the foot drop occur. Now, why these muscles get paralyzed? Because of the because of the injury of the deep peroneal nerve. So, as a result, what will happen? It result in loss of power of dorsiflexor of the foot. So, these muscles, whatever I have mentioned, these are the dorsiflexors of the foot. तो अगर ये nerve injure होगा, then this muscle will get paralyzed. If these muscles will get paralyzed, dorsiflexion will not take place. As a result, foot drop will take place. Okay. Now, as a result, what will happen? Foot is in plantar flex position, and this condition is called as foot drop. And you can see in the diagram. So, this is the common peroneal nerve, and you can see this is the image to the deep peroneal nerve. This one damage to the deep peroneal nerve. Now, this deep peroneal nerve is the nerve of the anterior compartment of leg, which is supplying the muscles of the anterior compartment of leg. And these muscles, what is their main function? Dorsiflexion. So, if this particular nerve is injured, muscles will get paralyzed. As a result, what will happen? Foot will become in plantar flex position, and that is called as foot drop. Okay? Now, along with that, now this usually caused by the disease of common peroneal nerve due to trauma, leprosy, peripheral neuritis, etc. Now, there will be sensory loss also, which confined to first interdigital cleft. Okay, sensory loss will also take place. Okay, in the first interdigital cleft, as you can see. So, this particular area there will be no sensation. Okay, so that's all about the applied importance. So, as much as possible, I have described the applied importance. So, here the sciatica, that means anatomical basis of the sciatica, that is important. Anatomical basis of the foot drop. These two applied importance are very common. Okay, commonly asked. Okay, so that is all about the topics which I have started. In between, only one part is left. That was, I think, this one, deep peroneal nerve. Explanation of the deep peroneal nerve that you can study from your own. Now, please note one thing, that the nerves which I have mentioned, okay, that was up to the leg region only. The foot region is left. Both the surfaces, that is the dorsum of the foot as well as the plantar surface of the foot. Okay, so for that, next week classes are there. At that time, those topics will be explained. Okay.